But we really just wanted to take a little bit of time. We've answered the questions, I think, what are the Basel statements and why are we using those as our foundation? And we've answered the question of why we're holding the summit and how it will work, or rather what's involved. And what I'd just like to touch upon is our voting mechanism, so that any organisations that do get involved have a sense of what the participation is. Really thinking of any process for a summit, we've got to think about what it is we're trying to achieve, what we can learn from other people who've done this before, and I mentioned earlier the Dumpee Method and the consensus voting. So those will be two main parts of what we do, and then what we hope to produce at the end of all of that. So there are three things we really want to achieve. One is to create very robust statements that are being subject to strong scrutiny and that can then form with confidence what we're trying to do in Europe in terms of practice development. And as Roberto explained, we really want to make sure that we take on board the full diversity of European health systems so that our 34 member countries can input how a certain statement works from their perspective, and that we have something that can be universally applied, that doesn't just apply to a single set of countries. And then we want to ensure that we've really brought on board the patient opinion and that we've brought on board the opinions of doctors and nurses so that this is an agreed way forward. So the way to do that is to have an open consultative process to ensure the scrutiny, to reach out to our members and to closely involve representatives of patient and doctor interests and nurses. So we touched upon the Basel statements and Lee gave a very good exposition of how that worked. So this was, to us, seemed a pretty good model to think about, including plenty of work before the summit itself to refine and ensure a precise statement building process, to divide the work into the various areas of hospital pharmacy. So like any big piece of work, break it into chunks, and to make use of delegate working groups to where there is any area where consensus is still to be formed, that we can take that to one side and work towards a consensus. We also looked very, very closely at the ASHP's Dallas Summit, which again we thought was nicely focused on its outcome in terms of how hospital pharmacy in America could take the consensus statements and put those into a tool. So they developed a series of online web-based tools such as a self-assessment survey, and that was really quite influential in our thinking. So we're taking the lesson of reaching out for broad representation of both our members and patient public. We will do significant scoping work beginning in October and hopefully finish most of that by March in our Congress using the Dumpee Method. So that'll be an online process working with partners to refine our statements, and throughout the project, from the very beginning, have a relentless focus on implementation. So the Dumpee Method, for those less familiar, it's really I suppose it's a structured communication technique. It's been quite tried and tested. It was developed in the 1940s. So the Dallas Summit was an example of using that process. 174 items were sent out to their members, to the delegates, and they were able to already pass 85 statements before they even had a summit. So that's quite an efficient way of conducting a piece of work like this. They were also able to define statements that there was no need to take them to the summit because there just wasn't the required agreement. And the remainder of the survey items then became the focus of their event. So we will do similarly. We will test what we're trying to do from October, several rounds, and take the rest to a summit in May. We will use a system of weighted voting. So this is a little bit different because unlike those other two summits, we're going to take a bold move and bring in non-hospital pharmacists. And the way we will run that, operate that, is to divide the voting 50-50. So pharmacists have 50% of the votes, 25% for patients, and 25% for other healthcare professionals. And this just on the side is a system of weighting. So the 34 members, each with a vote each, patients will have a total vote of 17, which, depending on the number of organisations, we will conduct a weighting exercise to make all of that proportionate. So the thresholds that we're looking at the moment, 85% total of agree or strongly agree to pass a statement. And that figure means that there has to be not only a majority of hospital pharmacists supporting a statement, but there has to be a majority of patient and professionals. So it's a joint decision-making process. If there's less than 50%, the statement falls, and in terms of agreement, and we move on. And then we have this purple area here, that's the sort of the summit focus, is where we need to refine and develop the statement. So by the end of all of that, I think we should have something that's been thoroughly tested, that stands up to scrutiny, that has what we want, which is the full input of patients and professionals, as well as the broad sweep of European hospital pharmacy systems. And then from there we can really build on a solid foundation to the rest of our development activity. So our timelines, things are underway. We've already begun the process of inviting patient professional groups into what we're doing. Our members passed the summit at our General Assembly in June, and we'll be asking them to nominate individuals to the Dumpee process, and all of this will commence in October with quite tight deadlines, so they'll have 2 or 3 weeks to give us their feedback. We'll then send out again. And if you're at our Congress, we hope to have plenty of news to report, and a very focused summit in May. So I just really want to make another call here we have, I hope, some patient organisations with us tonight. The European Patients Forum are fully behind what we're doing. We're working in partnership with them. We have a number of healthcare professional organisations already expressing interest, and we'll be announcing in the coming weeks more of those organisations, who they are. But I think we're already, prior to our launch tonight, have generated quite a bit of interest just by word of mouth, and I think we should be successful in bringing in this participation, which I think will really add that extra bit of value.